Krausz. I'm a psychiatrist with a passion for web and social media and technology. I organized my first conference on computer use in medicine in the early 80s and already started to deal with my, I say that especially because our colleague here said, oh yeah, I started very early in programming games, and I have a little history also to bring with me, just to mention beginning and why we are. So let me do a little warm up, and hi there, welcome. A little warm up and to open the floor a little bit and hopefully make you a little curious. And my interest is also to use this opportunity for dialogue and for discussion, because actually we are meeting and discussing and presenting about an area which is not mainstream so far, which is, I think, upcoming opportunities, but it will evolve very fast, and I'm totally convinced of that. And I would like to share a few thoughts in the title Broadening the Scope, and hopefully we'll be able to deliver on e-mental health beyond the usual, but I'm in good spirit there. Okay, blowing into an old horn. So a little bit, I think the discussion around e-mental health. Good morning, Heather.
Good morning. It's snowing.
Really? Actually, okay, I share one dream before I go into the more technical details. This night I woke up from I had a very nice. I was in a snow resort, skiing and whatever, and then when I was doing my back and forth, I thought, oh, I have to give a presentation. How do I get fast to Children's Hospital? And then I woke up, unfortunately. So it makes up kind of the snow, the skiing, and probably my hidden wishes to have a nice holiday to the work we have to do in the next 2 days. So blowing into an old horn means I think that I think the hard work we have to do in the next little while is to make people and help people to understand what the new opportunities of using web and social media are, and not just to do things in a linear way, just do a little more and a little faster. I think it's really about a quality shift. It's about accessing new possibilities and not only producing things you could also use and develop in a non-digital way. So that's the thought we want to stimulate and we want to discuss with you. Because I'm convinced that e-mental health will be a specific and a very special area of healthcare delivery developing in the next, let's say about 5 to 10 years, which will take over a significant part of healthcare, of the healthcare business. Significant part in terms of not probably about the amount of funds, but the people served. The people served, the role in the healthcare business. And this is one issue we really want to address. So what the reason for this presentation, okay, somebody has to start, and I would like to talk a little bit about paradigms and about narrow and broader views and what I really think is a key issue. Because the reason I'm very much interested into e-mental health is not so much the technology. It's really, I think it's a tool to shift paradigms in healthcare delivery, which I think is necessary. And I especially will tell you what the key paradigms are I have in mind. And you will see a few more during our conference being addressed. Okay, old and new thinking. So why is it important to broaden the scope? Because otherwise we spend a lot of money on technology with not much change happening. And I think that's a major concern I have participating in a lot of discussion around strategy, around funding, and whatever it is. That SAP and Oracle and others will kind of, oh wow, a new area of business. And then, like happening in the health authorities here right now, there's an electronic health record, the 10th version, after in the last 25 years. And it costs about 2-3% of the overall healthcare budget, and not much is changing. It's not much is improving. And that's really the concern I have, and I think it's really important to convince people about opportunities and about what an appropriate use of those technologies will be, and what the paradigms are which should drive it. So if I say excitement, I think that stands for the reasons people were interested into e-health or digital technologies in the first place. And telehealth was one of the first things in Canada, but also in other countries. And it was pretty much about serving remote communities with a very one-to-one, I say synchronous communication pattern. So you talk to each other. It doesn't build much capacity. People are sitting in a remote location. Somebody is sitting here, and that's how things normally work out. It was a significant investment. I was expanding a little bit on this idea, especially in Canada and the East. I was pretty surprised at 300 million, and a lot of money they're investing on an ongoing basis in this area. But it's still based on hardware investment, on discussion around privacy. You have a secure camera here and a secure camera there, and you talk about, say, that's kind of a discussion from yesterday, I think. Considering that also the Pentagon today is using web-based communication tools. You know how paranoid they are. So segment 2, and that was part of the discussion in the CHR workshop also, is the whole issue of big data. And I'm not so convinced that the whole discussion around big data means enormous database, so you just collect and then try to connect it, and you will find significance anyhow because it's so big. And as a statistician, we love big data. But from a health perspective, and from what we have in mind for the future of the healthcare business, of e-mental health, big data, I think, is not a significant big piece of it. And I already said that I'm a little concerned that big companies like SAP are able really to take over the process and just make a big business out of it without significant improvement of healthcare delivery. So there are a few examples in service research or clinical work, but I'm not convinced that that is really the key point and should have the key attention. It's good for epidemiology, it's good for monitoring and studying, also understanding small, but I think it won't address the needs of a mentally ill or challenged person or even chronic ill persons. I think there are other and better strategies to choose. And the third thing, and I'm that was already a point in the early 80s, electronic health record. Everyone was excited, no more files to whatever to keep, and everything will be transparent. And I thought, okay, 30 years later, here we are. Paris in Vancouver will be abolished, and there is a new tool, and nobody really knows whether that's much better, but it will cost about 3% of the budget, enormously much. under the fearless leadership of IBM. So I'm also, as you see, I'm not convinced that this will change healthcare delivery and improve. Because it's, I think there is a problem in how things are addressed. So top down, very much, and following paradigms of healthcare delivery, documentation, and other things which are not really effective. The risk is a risk of lost opportunities. So that's the reason we want to broaden the scope and motivate it. Things are possible in a different way. And I really think there are two things which are key, and we will hopefully be able to discuss that during our meeting here and in the coffee break and whatever. One thing is it needs to be value-driven and paradigm-driven, and it needs to be focused on clients and client needs, and not driven by the system and system needs. And that's probably the most difficult thing to do. And it needs to go beyond what we're already doing. It needs to use new development and technology in an innovative way. So this is the idea. eMental should address immediate patient needs and improving access, providing direct services and support, improving quality of care. And we need to be able to assess that and document that. And this is more effective. And we will be able to raise the funds too. Second, eMental should be developed based on lived experiences and should involve users in a strong way. User lived experience also from a professional perspective, but especially from a client and family perspective. And third, technology should be part of integrated solutions and not a burden to the system, which is very, so you have, for instance, an imaging facility, you need to take care that everybody is going through it. And you have a certain documentation system and you need to use it whether it makes sense or whether it makes any sense. So I think it's about solutions and not, technology needs to support solutions, and organization has to follow content and not the other way around.